You have been meaning to start this assignment for 3 days, not because you do not care about it, because you care about it too much. Every time you sit down to begin, something stops you. A voice that says it is not going to be good enough, that you do not have the right angle yet, that you need to think about it a little more before you start. So you wait, and the deadline gets closer, and the pressure builds, and now you are writing it in a panic at the last minute, hating every word, convinced it is terrible, submitting it anyway because you have no choice. And somehow it comes back with a good grade, and you feel relief for about 20 minutes before the cycle starts again with the next thing. If that sounds like your life, this video is going to explain something that I think you have needed to hear for a long time. Let's start with why ADHD and perfectionism seem like they should not go together, because I think the apparent contradiction is what makes this combination so hard to recognize and so hard to get help for. The cultural stereotype of ADHD is someone who is scattered, careless, and impulsive. Someone who does not finish things, does not care about details, and moves through life leaving a trail of half-done projects behind them. Perfectionism is the opposite of that stereotype. It is caring intensely about quality, being hypercritical of your own output, and holding yourself to an impossibly high standard. So, when a high-achieving ADHD person describes being paralyzed by perfectionism, the people around them often do not take it seriously. You have ADHD, they say. You are not a perfectionist. You just need to focus. And the ADHD person who has been told their whole life that their struggles are not real or not serious enough internalizes that dismissal and keeps carrying something that nobody is helping them name or address. The truth is that perfectionism is extremely common in ADHD, particularly in people who are high-achieving, late diagnosed, or who have spent years masking their ADHD traits in academic and professional settings. And the specific way perfectionism manifests in ADHD brains is different enough from the neurotypical version that standard perfectionism advice often does not work and sometimes actively makes things worse. Let me explain where ADHD perfectionism comes from, because understanding the origin changes how you work with it. For most people, perfectionism develops from a combination of high standards, fear of failure, and the belief that their worth is tied to their performance. Those elements are present in ADHD perfectionism too. But there is an additional layer that is specific to ADHD neurology, and it is rooted in a lifetime of inconsistency. ADHD brains are inconsistent performers by definition. On a good day, medicated, well-rested, genuinely interested in the task, the output can be extraordinary. On a bad day, unmedicated, depleted, low interest, the output can be genuinely poor. That inconsistency is neurological, it is not a character trait. But when you live with it from childhood, when your teachers and parents and coaches see you produce brilliance one day and struggle to produce anything the next, it creates a very specific belief system. The belief is something like this: my good days show what I am capable of. My bad days show what I really am. And if I can just try hard enough, be careful enough, prepare enough, I can make every day a good day and prove that I am really the capable version of myself rather than the struggling version. Perfectionism becomes a strategy for hiding the inconsistency. If everything I put out is polished and excellent, then nobody will see the days when I could not do anything at all. That is a completely understandable response to a genuinely difficult neurological reality, and it is also completely unsustainable. Because the days when you cannot do anything at all keep coming regardless of how hard you try to prevent them, and every time they do, the shame of not meeting your own impossibly high standard makes everything worse. Now let's talk about how ADHD perfectionism actually shows up in day-to-day life, because I think the specific patterns are worth naming clearly. The most common manifestation is task paralysis, not laziness, not avoidance in the traditional sense, but a genuine inability to start something because starting means producing something that might not be good enough. The blank page is safer than the imperfect first draft. The unstarted project cannot fail yet. And so the task sits and sits and sits while the deadline approaches and the anxiety builds and the eventual panic submission feels like proof that you cannot do things properly. The second manifestation is over-preparation, spending significantly more time researching, planning, and preparing than the task actually requires, because beginning to produce feels premature without more information, more certainty, more readiness. Over-preparation feels productive and responsible. It is often a form of avoidance dressed in the language of diligence. You are not procrastinating, you are just making sure you are ready. Except ready never quite arrives because there is always more you could know. The third manifestation is the infinite revision loop. You start something, you produce a draft, and then instead of finishing and submitting it, you revise it, and revise it again, and again. Each revision feels like improvement, but the bar keeps moving. The draft is never quite right, the submission keeps getting delayed, and eventually either a deadline forces your hand, or you abandon the project entirely, because it has become something you can never finish to your own satisfaction. The fourth manifestation is binary evaluation. Everything you produce is either brilliant or worthless in your own assessment, with very little middle ground. A piece of work that is genuinely good but not perfect gets mentally categorized as a failure. A clinical session that went well but had one moment of uncertainty gets remembered primarily for that moment. This binary thinking is exhausting, and it makes it impossible to build genuine confidence from your actual performance because your own evaluation system is calibrated to only register the gap between your output and perfection rather than the distance between where you started and where you are now. Let's get specific about how ADHD perfectionism shows up in healthcare training, because in clinical settings it creates some particularly costly patterns. The most immediate clinical consequence is the one I mentioned earlier: task paralysis around documentation. Many ADHD healthcare students spend significantly longer on documentation than their peers, not because they are slow, but because they cannot bring themselves to submit a note until it feels exactly right. Every word is reconsidered, every phrase is revised. The note that a neurotypical peer would complete in 10 minutes takes 30 because the perfectionist ADHD brain cannot accept a good enough note. It needs to be the perfect note. The second clinical consequence is difficulty asking for help. Perfectionism creates a belief that needing help is evidence of inadequacy. So the ADHD student who does not understand something, who is struggling with a clinical skill, who needs more support from their supervisor, often does not ask for it. They try to figure it out alone, or they perform confidence they do not have, or they let the gap grow rather than expose it by asking a question. In healthcare training, this is not just a learning problem, it is a patient safety issue, and it is one that perfectionism actively creates. The third clinical consequence is overinvestment in individual patient encounters at the expense of the broader caseload. Perfectionist ADHD brains can hyper-focus on making one patient interaction absolutely perfect while the rest of the day's responsibilities wait. The encounter that was supposed to take 30 minutes takes an hour because you were not willing to end it until everything felt resolved and excellent. The consequence is a schedule that falls apart, other patients who wait too long, and a supervisor who is observing a pattern that looks like poor time management when it is actually perfectionism operating at a clinical level. So, how do you actually work with ADHD perfectionism rather than being controlled by it? I want to give you concrete strategies because I know how easy it is to hear be less of a perfectionist and feel completely unsupported by that advice. The first strategy is separating starting from finishing. One of the most effective interventions for perfectionist task paralysis is giving yourself explicit permission to produce something terrible as a starting point, not as your final product. Just as a first draft that exists for the purpose of having something to react to rather than nothing, the terrible first draft strategy works because perfectionism's power comes from the blank page. When nothing exists yet, everything is at stake. When something exists, even something imperfect, you have something to work with rather than something to fear. You can fix a bad draft. You cannot fix something that does not exist. Getting something on the page, anything, removes the blank page as a threat and gives your brain a problem to solve rather than a void to fill. For clinical documentation specifically, this might look like writing a rough skeleton of your note immediately after the patient encounter, just the key facts and findings in whatever language comes naturally, and then going back to refine it rather than starting from scratch with the goal of producing a perfect final note in one pass. The second strategy is time boxing your perfectionism. Instead of trying to eliminate the perfectionist impulse, which is unlikely to work because the impulse is deeply wired, you contain it within a defined time boundary. Before you start any tasks, set a specific time limit for completion. Not an ideal time limit, a real one that reflects how long the task should actually take. When the timer goes off, the task is done. Not perfect. Done. You submit what you have. You move on. The time box is not negotiable because if it is negotiable, it will expand every time and you are back where you started. This strategy works by externalizing the completion signal. Instead of relying on your internal sense of when something is good enough, which for a perfectionist ADHD brain will never arrive reliably, you use an external signal, the timer, to tell you when it is time to stop. Over time, this trains your brain to associate completion with a timer rather than with the feeling of perfection, which is a much more achievable and consistent standard. For healthcare students, this is particularly useful for documentation, for studying, and for any written assignments where the revision loop tends to take over. Set the timer, work, stop when it goes off. Trust that good enough submitted is worth more than perfect unfinished every single time. The third strategy is reframing what good enough actually means in a clinical context. Because I think one of the reasons perfectionism is so persistent in healthcare students is that they genuinely believe that good enough is dangerous. That clinical work demands perfection, and that settling for anything less is a risk to patients. That belief is understandable, but it is not accurate. And I want to address it directly because it is the belief that keeps a lot of ADHD healthcare students trapped in perfectionism long after they have intellectually understood that it is not serving them. Clinical excellence is not the same as clinical perfection. No clinician, regardless of experience, skill, or neurotype, produces perfect clinical work every day. What experienced clinicians produce is consistently good enough work, delivered reliably, with appropriate safety nets, and with the self-awareness to recognize when something is beyond their current capacity and escalate accordingly. That is the standard. Not perfection. Reliable, safe, good enough. The documentation note that is accurate and complete and submitted on time is clinically superior to the perfect note that is submitted 3 hours late because you were revising it. The patient session that covers the essential clinical ground adequately and ends on schedule is clinically superior to the perfect session that runs over and disrupts the entire day's caseload. Good enough, delivered reliably, is what clinical competence actually looks like in practice. The fourth strategy is building external accountability into your process specifically to interrupt the infinite revision loop. For perfectionist ADHD brains, the revision loop is hardest to interrupt alone because there is no external signal to tell you when something is finished. Your internal signal, the feeling of being satisfied with your work, is calibrated to an impossibly high standard and may never arrive. External accountability creates an artificial completion point that does not depend on that internal feeling. This might look like telling a classmate or a study partner that you are submitting an assignment by a specific time and asking them to check in. It might look like submitting a draft to your supervisor earlier in the process than feels comfortable so that the feedback you receive closes the loop rather than leaving it open indefinitely. It might look like sharing work in progress with someone whose judgment you trust and letting their response serve as your signal that the work is sufficient. The specific form the accountability takes matters less than the fact that it creates an external completion point. You are not waiting for your perfectionist brain to tell you it is done because that message may never come. You are using the external environment to provide the signal your internal system cannot reliably generate. I want to close by addressing something that I think is at the core of ADHD perfectionism, and that does not get talked about enough. Perfectionism in ADHD is often a protection strategy. It exists to protect you from the shame of inconsistency. If everything you put out is excellent, then nobody will see the days when you could not do anything at all. If you meet every standard, then nobody will have grounds to question whether you belong here. If you are perfect, then your ADHD cannot be used against you. That protection strategy made sense at some point. It helped you get here. It helped you build the reputation and the track record that got you into a competitive healthcare program. It is not something to be ashamed of or to pathologize. But it is also costing you more than it is giving you now. The paralysis, the revision loops, the inability to ask for help, the clinical time management problems, the chronic exhaustion of holding yourself to an impossible standard every single day. These are real costs, and you do not have to keep paying them at this rate. Working with your perfectionism does not mean lowering your standards. It means developing a more honest and sustainable relationship with what good enough actually looks like for a developing clinician who is doing genuinely hard work with a genuinely different brain. Your standards can stay high. Your relationship to the gap between your standards and your output just needs to become more compassionate and more realistic. You are already doing something remarkable. You do not need to be perfect to prove it. If you want tools for managing the practical side of perfectionism, including the task initiation strategies, the weekly planning system, and the clinical rotation framework that helps you work with your ADHD brain rather than against it, the Mind Emotion Clinical Focus Guide has all of that in one place. The reading guide and workbook are both linked in the description along with the complete bundle. Go check it out. Structure your mind, move with purpose. I will see you in the next one.